Time to verify. 12 News viewer Karen Van Weer wrote into us saying, I tested positive for COVID after having all the shots. I was told to quarantine for 10 days. My neighbor last month was told 7, and someone else just today was told 5 to 7 days. So what's right? Well, the CDC recently updated their quarantine suggestion. They now say people who test positive for COVID-19 only need to isolate for 5 days, not the 10 that was previously recommended. Tonight, Verify's Brandon Lewis explains whether that means a person could still be contagious.
The Centers for Disease Control and Prevention is facing criticism in viral social media posts after it changed its isolation and quarantine guidelines for people who test positive for COVID-19. Several Twitter users claim a person who tests positive can still infect others, even after isolating for 5 days, as recommended by the new guidelines. So let's verify. Can a person still be contagious more than 5 days after their first positive COVID-19 test? Our sources are the CDC, the World Health Organization, Houston Methodist Hospital, and Harvard Medical School. The CDC says the change is motivated by science and explained COVID-19 is most contagious from 2 days before symptoms begin and up to 3 days after. The CDC did not say a person is no longer contagious after 5 days, only that they no longer have to isolate, and recommends they strictly wear masks when away from home for an additional 5 days. Doctors at Houston Methodist Hospital and Harvard Medical School determined people are likely no longer contagious 10 days after symptoms begin. So it's true. A person can still be contagious more than 5 days after the first positive COVID-19 test. On Sunday, Dr. Anthony Fauci said the CDC may change its guidelines based on the feedback and is considering recommending a negative test to end isolation. With your Verify, I'm Brandon Lewis.
And if you've got a question, you can email verify@12newsnow.com or hit us up on social media.